Learning how to give your cat fluids under the skin, or sub-Q fluids as we call it, stands for subcutaneous, is a little bit of a daunting task. However, almost anybody can learn to do it, and cats can be very tolerant of the procedure. So when you get your kit, it's going to look like this. This is the fluid bag, this is the fluid line, and these are the needles that we'll send you home with. So I'm going to show you how to set it up. The fluid bag has a slit in it for tearing. You open it up, which is a little wrestling match, or a big wrestling match. There we go. And inside is the actual bag of fluids. This also comes with a tear line, and inside is your fluid line. Your fluid line has a roller here which pinches off the tube. This is what keeps the fluid from flowing out when you don't want it to. And you can actually feel it get tighter against the tube as you roll it down. That shuts it off, this opens it up. This end goes with the bag, and you know that because it has this really big end post on the end. This end is where the needle is going to go. So you pull the cover off. The needle has a plastic cap on the end. You just twist to take that off, and then the needle attaches here, and then this piece tightens to keep the needle in place. Then this end also has a cover that you need to remove, and you're left with a very, very sharp point. That point is what's going to go into your fluid bag. This is also a cover. You peel the cover off, take the sharp point, line it up with the hole, get it nice and straight, and then push. And this takes a little effort. Get that in there. Okay? It helps if you do it with the bag hanging this way so that the fluids aren't going to leak while you're pressing. Then you turn the whole thing over. The fluids will run into the chamber and start running down the line until they're coming out of the needle at the bottom. Let it run through until there's no more air bubbles. Then close your fluid line with your roller, recap your needle, and now you're ready to go. Giving the cat the actual fluids under the skin, you want to have them in a position that's relatively comfortable. On a table is good, on your lap might work, or on the couch next to you might be another good spot. And it often helps to have somebody to stand by and give them a little loving and a little distraction at the same time. And what you want to do is to take your needle, take the cap off of your needle, hold it like this, and you're going to grab the loose skin between the shoulder blades and just lift it up away from the body a little bit. It makes a little tent underneath there. And then you're going to aim at this angle. You don't want to go straight down. You want to go more parallel to the cat. You're going to go under your thumb and pop through the skin. Then you can let go and check to make sure that you're not actually all the way through the other side. You can actually feel it with your finger. If you were all the way through, you'd find it. So it's setting in there right now. It's under his skin. Then, once you have it in position, you can then unclamp your fluid line and raise your fluid bag. And the fluids are going to start to flow in. And Mufasa thinks we're very strange. When you've gotten the amount of fluids that you want to have in, which is determined by these numbers on the side and by what the vet has directed you, then you just pull the needle out, which Mufasa has done for us, recap it, and always change it immediately for a clean needle. Always leave it with a clean needle in place. That way you can reuse your fluid line without having to change it between treatments, but never have bacterial contamination of the fluid line. Once he's all settled in, you can just gently massage over the site and rub the fluids into position, or if he prefers, let him go.